everyone. My next guest has been on with me now several times. I have with me John Fidelo. John, you are the owner of Fidelo Health and Employee Benefit Services.
Yes.
And John, you absolutely love what you do, and like I do. And the reason why is because you help people understand. We've been talking about complicated subjects, right?
Right.
Earlier.
Right.
And this one is pretty complicated. So tell everybody a little bit about yourself and what you do and how you help people understand some questions they might need to find out about.
Well, I've been an independent broker now for the past 33 years, so I'm an old timer. And with the advent of the Affordable Care Act, most of my focus is in the push of helping people through, what could be a very frustrating scenario. Now, when the Affordable Care Act was introduced, there's some great things about it that are genuinely there to help people, but it's been a work in progress, right? So in other words, if you choose to go on the exchange or with the Affordable Care Act, and by the way, the Biden administration has now opened that up through August 15th, which is fine. And if you go on the exchange, you have to understand a couple of different variables. One, if your income is in a certain space, you are able to get a subsidy from the government towards that premium. But what people don't realize is that if you're an entrepreneur and you're reasonably motivated, if that income shifts and gets to a different space, you have to pay that money back. And if you don't do the reporting along the way, you have to pay it back with interest. People don't, realize that. Now, if you have some extraordinary and difficult health issues, it's covered. These companies have to pick that up immediately. So that's a positive aspect. But on the other side of it, these networks, they're only HMO structured, right? So these networks of docs and hospitals are very narrow. And what I've learned just recently too, I have clients who are doctors who tell me, a lot of docs won't even consider being involved with that. So I do get phone calls from people to say, can you recommend an internist or an orthopedic? My doc was a part of the network. It's not a part of the network any longer. And the reason for that, there's a couple of reasons. One, just because of the way that doctors get paid, the way it's structured, there's a longer delay in getting paid. And the hard number that I learned recently from a claim advocate, person that I work with, is that years ago, a doc would get 50% of what they charged in an HMO type of a setting. Now that's 17%.
Big difference.
Big difference in terms of how a person's getting paid. Now
Right.
the other area, and just to clarify this too, is if you sign up in the Affordable Care Act in Maricopa County, that's your service area. If you go out of the service area, technically you're not covered. In an emergency situation, you're covered. In other words, you have to be stabilized and brought back to Maricopa County. But say if you're a resident in Arizona and you got family in Colorado, and in the summertime, 2-3 months, you're going to be out of town, you're actually not covered. So with those variables, people don't necessarily appreciate those variables.
No, I didn't appreciate it when I found out when it was too late, right? Because my daughter was in New York and she wasn't covered. And it was scary, because now what do you do? And then you're scrambling. And you don't have to scramble. And that's why you listen to the show.
Right.
So you can get this information and write it down and make some phone calls and talk to these people because they're here to help. Right? And, you work valley-wide.
Right.
You do free, your service is a free service. So, I've said this before, it just makes sense to have a conversation with you and find out, how you can help to make sure, just find out, are you on the right plan? Is it right for you? You do that all the time.
Right. In other words, what you're paying for, you have to understand all the variables associated with what you have. And once you understand those variables, then you decide budget-wise if it's feasible and it makes sense for you to continue that way.
Now you have a new website that you're pretty excited about. It's Healthcaresimplified.info. Yep. And also your phone number to call direct. It's 480-205-8806. He's been doing this for 33 years. And so he really knows what he's talking about. And to try and do this on your own, it isn't, and I'm gonna use my ex. I'm sure he's probably listening, but he thinks I could do this, right? You can't always do it because you don't. I said it earlier that you don't know what you don't know.
Well, you know, I always like to give examples, right?
I
So
love 'em.
I get referred this scenario, and one of the people, they were possibly considering setting up a group coverage plan, right? So the one principal had rheumatoid arthritis, and he was taking a complicated drug called methotrexate. Okay, now these people were not fully understanding. They were sold something that they don't fully understand. So they have a short-term option with one of the carriers that I do work with, right? And in certain instances, short-term could be appropriate, but it's not a permanent solution, so to speak. What I found real interesting when I was, you know, on the exchange looking to just show or compare different scenarios and options, you know, that drug is not even covered in the formulary. And these people are gonna still continue to pay for this, you know, out of pocket at Costco. I mean, there's some ways that you can get that a little bit less expensive, like people have the Good RX app on their phone.
Right.
I
I
have
found
a couple
that
of,
out.
yeah, that's very
very
handy,
handy.
really handy, because most of these generic drug, well, most of these prescriptions are generic now. They're all like $4 and $8, you know. The more complicated ones, I have contacts in the Midwest, but I have 2 pharmacies that I've worked with that I've vetted real hard out of Canada, and people will say, "Well, isn't that illegal?" And I don't know where you got that information, but no, it doesn't work that way.
And this is where you come in.
Right.
And you can sit down and talk to you. And anybody listening right now, and a lot of our listeners you're taking more than one prescription, right? And it could be even that you are on insulin, let's say. I'm going to use that as an example because it's a good one. I think you've used it before. There's so many different ones, and they are not all covered, right?
Right.
That's another story.
See, health insurance, what I try to tell people, it's about a solution. And you have to review this on a regular basis, you know, to see where you're at. I'll give you an example, okay? And this is just in the last couple of days. So, have this lady who's a client, and she's on what they call a limited benefit indemnity plan, which simply means that there's a certain scheduled payout for different what they call CPT codes or surgery schedule codes, right? And certain amount that's allowed for the hospital. Now, her son had a hernia, and a lot of frustration that I have is working with or around any of these hospitals. So this kid went the conventional way, and she didn't contact me and to discuss this a little bit further. For the amount that, for the day that this kid would have been in the hospital, I've seen Honor Hospital send out bills for $40,000. Okay, so with the better.
That's why they got places all over the place that could do that. It's crazy.
Well, hospitals too. I mean, they take a lot of indigent people. They're not getting, because of the virus, they're not getting elective surgeries and certain things that are standard. So they send bills out to people and try to scare them into paying them with threatening to go to collections. And you get a lot of people that say, "Well, I don't want a problem with my credit. I should just pay that $12,000." And no, you don't pay that $12,000, right?
Wow.
So in this scenario, what this client didn't realize is that at Honor Hospital they have a hernia package. Doctor that I gave them was looking at a cash price, a total cost of about $3,500 all in for that surgery, where if they went the conventional way, there would have been a large bill that would have come after the fact here. But going into understanding what the package is and understanding what this indemnity benefit plan will pay, she may be out of pocket about $700 or $800, which she would have been out of pocket thousands of dollars or had to pay a claim advocate to get involved and get that bill taken care of.
That's why you call John. He can help. His phone number is area code 480-205-8806. His website is healthcaresimplified.info. He works valley-wide, and it is free. This is a free service to you. You can also find him on LinkedIn at John Fidelo, Fidelo. You can you can also check him out there too. We have less than a minute.
Okay.
Just finish your store. What do you want to say?
What I want to say on the group side for small businesses, there's some interesting things going on. I've mentioned this before and I love it. They have these, what they call these medically underwritten plans. So if your group is healthy, it's going to be a difference, a savings from the guaranteed issue type of spreadsheet that I would normally run, all right? And what I like about it is that because it's medically underwritten, and because if you got a healthy group going in and you're not paying as many claims that particular year, you could possibly participate in a partial refund of premium.
I'm telling you now, you got to call John. Better call John. That phone number is area code 480-205-8806. You know what? He says it all the time. He can help you hit it out of the ballpark to make sure that you guys are covered correctly, and also to be making sure that you pay the littlest you have to. Is that a word? 480-205-8806.
All right.